Most people with type 2 diabetes know they need to do something when their blood sugar is high, but they don't. Why is that? It's not because people are lazy. And in this video, I'm going to share the 4 reasons that people stay stuck with high blood sugar with type 2 diabetes. Hi there, my name is Cory, and I'm a pharmacist that helps people lower their blood sugar and reduce their need for medications. And today, we're covering the 4 reasons that people stay stuck with their type 2 diabetes. The reason number 1 is that diabetes and high blood sugar really doesn't hurt when it starts. Now, yes, there is diabetic neuropathy, which can develop over years. When you have serious problems where you have to cut limbs off, you have heart attacks, yes, there is pain there. When you're first starting the process of having higher blood sugar, it doesn't exactly hurt. And I've talked with hundreds and thousands of patients and clients who say the same thing. I know I should do something, but it doesn't really hurt. And that's why it's so hard. If you break your leg, it hurts and you take action immediately. But with high blood sugar, it's kind of hard to feel until it doesn't. With high blood sugar, it doesn't hurt until it does. Until you develop the neuropathy, the heart problems, the dialysis. So instead of taking action like someone who's got hit in the head or has something sticking out of them like they getting stabbed, you let it go and say, I'll take care of it later. And us humans, we're not good at thinking about future problems. So the first reason that people stay stuck is because it doesn't hurt in the moment. Reason number 2 that people stay stuck with their type 2 diabetes is they focus on the tactical instead of the strategic. And here's what I mean. They zero in on meal plans, carbs, calories, fat, working on the specific exercises they have to do. When in reality, strategically, looking at the big picture, they have an environment that's set up to make them fail. Yeah, you can have the perfect plan for carb counting or exercise, but if you can't get to your gym shoes, you're never going to actually work out. And if that gym is an hour away and you live a real busy life like most people, good luck actually going. And yeah, you have the best intentions to come home and eat that salad with the chicken on it, but you left the brownies right in front of it. Here's what I'm saying, is that tactics are important and we can't ignore them. But strategically looking at your environment, if you don't set yourself up for success, you're going to fail. And that's why that's the number 2 reason that people stay stuck with their type 2 diabetes, is they get stuck in the minutia of tactics without stepping back and looking at strategically how all of these actually will fit into their life. Reason number 3 that people stay stuck with their type 2 diabetes, they think that everything they do has to be perfect instead of just good enough. They need to have the perfect diet, the perfect exercise regimen. They have to track themselves perfectly. And because they think they have to be perfect, they don't ever start because, I don't know about you, but nobody is perfect. So they let perfect be the enemy of good instead of just good enough, because good enough gets you started. Cut out some of your soda. Stop snacking every day. Focus on one meal a day where you prioritize protein, get enough fiber in so you stay full and you don't spike your blood sugar. Take a 2-minute walk after each meal. These are not going to win any fitness awards or make me any friends in the dietitian community probably, but it's a way to get going. So instead of thinking you have to be perfect and staying stuck, just get good enough and get going. Because reason number 3 was thinking you have to be perfect instead of just being good enough. And reason number 4 that people stay stuck with their type 2 diabetes is the healthcare system can be confusing and overwhelming. Now, I'm not here to throw doctors, pharmacists, nurses, really hardworking professionals under the bus. I am one of them. I am a pharmacist, like I said. But when you think about the fact that you get a 7-minute appointment with your doctor, and then you go home and you try to look up things on your own because you don't have time to actually speak with a doctor to get a good idea of what you need to do to get your blood sugar down, it can be overwhelming and confusing. You see a doctor, 7 minutes, take this prescription, take that prescription, check your sugar 3 times a day. If it's high, call me. If it's low, call me. So you go home, you got to figure out a solution. So you look up on the internet and it says, eat low fat, actually eat low carb. Meat's terrible. Meat's great for you. It's overwhelming. And so what do we do when we are overwhelmed? There's fight, flight, or freeze. And I think a lot of times, in my experience, people just freeze and stay stuck in the same patterns that got them there. Okay? And I hear you. It's overwhelming. And that's what we're trying to do with what we provide with our YouTube videos and our podcast. The Diabetes Remission Roadmap is provide simple education to help you take control of your blood sugar. So if you're feeling overwhelmed, pick a source, pick one small habit to change, and start working on it. Remember, good is better than perfect. So those are 4 reasons that people stay stuck with their type 2 diabetes. Let me know in the comments, what did I miss? What keeps you stuck? What keeps you frustrated? And you know what? I bet you I could probably make another video with 4 more reasons that people stay stuck, or 10 more reasons. If you enjoyed this, share it with someone who is struggling with their blood sugar. And if you think this was helpful, we know that you're going to love the Diabetes Remission Roadmap podcast. It's a weekly podcast that myself and my co-host Brian, another pharmacist, put out every week to help people lower their blood sugar and need less medications for their type 2 diabetes. Make sure you subscribe, share with a friend, like it, leave a comment, and remember, keep it simple and do what works.